And one House Republican source tells NBC News that Republicans are planning to vote this Thursday on their plan to repeal and replace Obamacare on what happens to be the 7th anniversary of the signing of the Affordable Care Act. But despite leaders' plans, the House bill is facing stiff opposition from the conservative House Freedom Caucus and Republican governors. Ohio's John Kasich, Michigan's Rick Snyder, Nevada's Brian Sandoval, and Arkansas' Asa Hutchinson sending a letter to Speaker Ryan and Leader McConnell in opposition to the House bill's Medicaid provisions. They included an alternative plan to reform Medicaid that offers more flexibility to the states. Joining me now to discuss is Republican Congressman Robert Pittenger of Charlotte, North Carolina. Congressman, thank you very much for joining me today.
Good afternoon, Stephanie.
As of today, 20 of your Republican House colleagues do not support this legislation. Would you advise the leadership to vote on this bill next week? Don't you think they won't have the votes that they'll need at this point?
I think we have a great framework. Obviously, the leaving it at status quo is not acceptable. Obamacare is structurally not capable of existing and providing health care to the American people. It never was actuarially sound, and it's collapsing on its own weight. So that's really not an option. I think there are individuals, and I'll be at the White House tomorrow for a meeting with the Vice President, but there's input right now being given. But at the end of the day, I think we're going to come together and pass a great health bill that will allow the individuals to take over their health care again and take it out of government mandates.
Congressman, you wrote an opinion piece in the Wall Street Journal where you emphasized the need for compromise. Were you speaking directly to people within your own party who seem opposed to certain aspects of this bill pretty ardently?
Well, I've really commended Ronald Reagan and his leadership. And Ronald Reagan always said, I'll take 80% of the loaf and come back for the rest of it later. And we need that spirit today to be able to transform health care in this country. Look at what needs to be done with Medicaid. It hasn't been reformed in 50 years since its inception. And this provides important reforms for Medicaid so we can have it and sustain ourselves economically as a country.
Let me go back to the meeting with the president. The Republican Study Committee came away with 2 changes to the bill. First, giving the states the option to block grant Medicaid and also incentives for states to include work requirements for Medicaid. Do you support those changes?
Sure. I'm on the steering committee of the Republican Study Committee. I think they're good adaptions. If we can get those through and make them work in the House and also in the Senate, I would value that. I think those type of conservative reforms are important. And I also believe, though, that we need to be recognize the political realities of working with those on the other side of the Capitol and knowing that they have issues inside their states that some of us may not have. There's 500,000 people on Medicaid expansion in New Jersey alone. So these are important factors, and any thoughtful person entering into negotiation needs to understand the concerns of everyone involved.
All right, Congressman, I want to draw your attention to a part of the CBO's analysis that didn't get a lot of attention last week. 7 million people could lose their employer-backed health insurance over the next decade, particularly those who work for small businesses. What's your reaction to that number?
Well, of course, as you know, and CBO says themselves, that their projections, frankly, they haven't been consistent. They haven't been accurate. On page 25 and 26 of the report, they said, there's so many variables out there that the outcomes substantially could be far different. So I think you have to look with that understanding in mind that, as we saw on the enrollment in the exchanges, they projected 20 million people, and only 11 million people were enrolled.
But Congressman, certainly the CBO's analysis can be a guide to what could happen. And if we're looking at even just a fraction of those 7 million people who already have health insurance through their employer potentially losing it, how do you keep that from happening?
Well, what the CBO doesn't take in consideration are market forces. That's never part of their calculation. And the whole objective of our health care plan is to get it out of the hands of the government and create the market dynamics, competitive markets. And that's what really will drive prices down and make it more affordable for everybody.
Is that what your constituents are telling you?
No, that's what I know. I mean, I know that that watching the realities of market forces, market dynamics, whether it's any service or any product or anything, that's what we're trying to accomplish with our health care. You know, we have health care today, and it says that some number of people they have health care coverage, but they really don't have health care because the deductibles are so high that they don't utilize their health care. What we want is affordable, real health care that they can actually use.
Well, Congressman, just quickly on that point, you talk about market forces bringing down the price of health care. That's not an immediate thing, and we don't know how long that will take. Is that a concern among your constituents that it will take longer than they have, potentially?
Well, the concern is where we are today. When you have insurance companies like Humana and Aetna and others, Humana is going to pull out 2018. Aetna is saying this is on a death spiral. We have the trajectory for health care today with the current status is not acceptable. It is collapsing. And right now there's a third of the counties in the country that only have one health care provider, so insurance provider. So we don't have a sustaining system. And what we need to do is create the dynamic of competitive markets. And that in itself will bring prices down and make a product more affordable.
All right, North Carolina Congressman Robert Pittenger, thanks so much for your time today.
Good to be with you.